Have you ever experienced chronic pain, fatigue, or digestive issues without a clear medical cause? You've seen doctors, undergone tests, and perhaps even tried different treatments, but nothing seems to explain the persistent discomfort you feel. If this sounds familiar, you may be dealing with physical symptoms that are linked to emotional or psychological stress, particularly unresolved trauma. When the mind undergoes intense stress, especially from traumatic events, it can manifest in the body in unexpected ways. These physical symptoms are real and can be debilitating, even if medical tests don't show an obvious cause. This connection between trauma and physical symptoms is part of what's known as somatic experiencing, where the body holds on to trauma, leading to chronic issues like pain, fatigue, or digestive problems. In this video, we'll explore how trauma and stress can manifest in physical symptoms, providing insight into the ways unresolved emotional wounds may be affecting your body. We'll also look at real-life scenarios to illustrate how these symptoms appear and discuss strategies to manage them. What are unexplained physical symptoms? Unexplained physical symptoms are those that persist despite medical tests showing no clear cause. These symptoms are often linked to emotional stress or trauma. While they may seem like purely physical issues, they are often the body's way of expressing unresolved emotional pain. For many people, these symptoms can become chronic, affecting their daily lives and well-being. Let's explore some of the common physical symptoms related to trauma with real-life scenarios to illustrate how these issues can manifest in everyday life. 1. Persistent headaches or migraines without a clear medical cause. Headaches and migraines are common physical symptoms that can arise from unresolved trauma or chronic stress. If you're experiencing frequent headaches without a medical explanation, it could be your body's way of processing emotional pain. 1. The unrelenting headache. You've been dealing with migraines for years. You've seen specialists, tried different medications, and made lifestyle changes, but nothing seems to stop the headaches. They often hit when you're under pressure at work or after an argument with a loved one. While there's no medical explanation for them, you've noticed they always seem to follow stressful events. Headaches and migraines are often triggered by emotional stress. The body responds to the tension in your mind by tightening muscles, leading to physical pain. In cases of trauma, this tension can build up over time, manifesting as chronic headaches. 2. Chronic fatigue that doesn't go away with rest fatigue is one of the most frustrating symptoms of trauma. It's not the kind of tiredness that goes away after a good night's sleep. It's a deep exhaustion that lingers no matter how much rest you get. This chronic fatigue can make it difficult to get through the day, affecting your ability to work, socialize, or engage in activities you once enjoyed. 2. The exhaustion that won't lift you. Wake up feeling as tired as you did when you went to bed. You've tried going to bed earlier, changing your diet, and even taking time off work, but nothing seems to help. Even on your days off, you find yourself drained of energy, struggling to muster the strength to complete basic tasks. Friends invite you to outings, but more often than not, you decline because you're just too tired to go. Chronic fatigue is often linked to the body's constant fight or flight response, which trauma can activate. When the nervous system is constantly on high alert, it uses up energy reserves, leaving you feeling drained even when you've had enough rest. 3. Unexplained aches and pains, such as back pain or stomach problems. If you experience unexplained aches and pains, such as back pain, joint pain, or stomach discomfort, it may be your body's way of holding on to emotional stress. These physical sensations can persist even when there's no injury or obvious cause. 3. The lingering back pain. Your lower back pain started a few years ago, but there's been no injury or medical explanation for it. You've tried physical therapy, stretching, and even massage, but nothing has provided long-term relief. You've noticed that the pain gets worse during stressful times, when work is overwhelming, or when you're dealing with personal challenges. Emotional stress and trauma often manifest in the body through chronic pain. The back, in particular, is a common area where people carry tension, especially if they are constantly bracing for emotional pain or stress. The body holds on to this tension, leading to persistent discomfort. 4. Frequent digestive issues like nausea or irritable bowel syndrome, IBS. The gut is often referred to as the second brain because of its connection to the nervous system. Emotional stress can have a direct impact on digestion, leading to symptoms like nausea, bloating, or conditions such as IBS. When you're constantly in a state of stress or emotional turmoil, your gut health can suffer. 4. The unsettled stomach. You've been dealing with stomach issues for as long as you can remember. Nausea, bloating, and frequent trips to the bathroom have become part of your daily routine. Despite numerous doctor visits and dietary changes, nothing seems to resolve the problem. You've noticed that the symptoms get worse when you're anxious or stressed, but you can't seem to figure out how to stop it. Digestive issues are often triggered by emotional distress. When the nervous system is in a heightened state due to trauma or anxiety, it can disrupt the body's natural digestive processes, leading to ongoing gastrointestinal discomfort. 5. Experiencing rapid heartbeat, sweating, or dizziness, especially in stressful situations. When trauma is unresolved, the body's fight or flight response can be easily triggered, even in situations that aren't physically dangerous. You might experience physical symptoms like a rapid heartbeat, sweating, or dizziness, especially during moments of stress or anxiety. These reactions are your body's way of preparing for perceived threats, even if there isn't an actual danger. 5. The stressful meeting. You're sitting in a meeting at work, and suddenly your heart starts racing, your palms get sweaty, and you feel lightheaded, as though you're about to faint. The meeting isn't particularly stressful, but something about being there triggers a physical response. You try to calm yourself down, but the symptoms persist until the meeting ends. These physical symptoms, often related to anxiety or panic, are common among trauma survivors. The body has been conditioned to react strongly to stress, even in situations where there's no real threat. This heightened response can leave you feeling shaky, overwhelmed, and out of control. Managing unexplained physical symptoms. While these physical symptoms can be challenging, there are ways to manage and reduce their impact. Here are some strategies that can help. 1. Mind-body therapy. Therapies that focus on the connection between the mind and body, such as somatic experiencing, yoga, or mindfulness-based stress reduction, can help you release tension and trauma stored in the body. These practices teach you how to tune into your body's signals and release physical tension in a healthy way. 2. Trauma-informed therapy. Working with a trauma-informed therapist can help you address the root causes of your physical symptoms. Cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, are effective therapies for processing trauma and reducing its impact on the body. Third, grounding techniques. When you notice physical symptoms arising, grounding exercises can help you stay present and reduce the intensity of the symptoms. Focusing on your breath, engaging your senses, or gently stretching can help bring your body back to a state of calm. 4. Lifestyle adjustments. Paying attention to your body's needs through rest, nutrition, and gentle movement can help you manage chronic symptoms. While these adjustments won't cure trauma, they can provide relief and support your healing process. Healing the body and mind. Unexplained physical symptoms can be frustrating and debilitating, especially when they don't have a clear medical cause. However, recognizing the connection between your emotional well-being and your physical health is the first step toward healing. By addressing the unresolved emotional pain that may be contributing to your symptoms, you can begin to find relief for both your mind and your body. You don't have to suffer in silence. There are tools, therapies, and strategies available to help you manage and heal from the physical symptoms of trauma. You're not alone in this journey, and with time and support, you can reclaim your sense of well-being.